So these are some of the supplies that you'll need to change an ostomy bag. Some washcloths to perform ostomy care, a blue pad or a towel to give a barrier to your patient so that you don't get any stool on them, a stoma measuring kit so that you can cut the wafer to an appropriate size, which is about 1/4 inch away from the stoma itself, and a ostomy bag, which just clip together like so, a clip for your ostomy bag, a pair of scissors, and these aren't actually the right scissors, they're supposed to be curved, but it's all that the NTC has to cut the wafer with, a skin prep adhesive, a wipe to remove the adhesive of the old bag in case you have trouble, and this skin barrier between the wafer and the skin. If there's any breakdown, you usually won't need this, but if there's any like redness around the stoma, or any leakages, it would be good to put this on just as an extra barrier. And 2 pairs of gloves, one to wear while you remove the initial bag, and these to put on after you perform stoma care and perform hand hygiene. Don these while you put on the new colostomy bag. Okay, so the first thing you want to do is cover your patient with a towel so that when you remove the bag, you don't get any stool on their gown or on their skin. You're going to wet a washcloth with some warm water, and you're going to take your adhesive removal wipe and lift up the adhesive on the wafer and rub around, try to get all the glue off and pull it off. Okay. And then you're going to take your washcloth wet with warm water and go around the stoma and then in the stoma, and you don't have to worry about being too gentle because the stoma has no nerve endings and the patient won't feel any pain. So clean around the stoma. So you can remove the dirty gloves after performing stoma care and perform hand hygiene, and then take your measuring device and measure the stoma so that you know which size to cut the wafer. And it looks like this one is perfect at 32 millimeters. So we're going to center the appropriate size over the wafer and take a pen, since this one doesn't have them already outlined, and just trace. Okay. So now you're just gonna cut the wafer along the line. And hopefully it's easier if you have real scissors. Okay, you can stop. So you're gonna take your cut wafer and you're gonna place it on the stoma like so. And remove. Okay, stop. So you're gonna take this skin prep and put it where the adhesive is gonna go. And then just press down, and it's not gonna stick because it's to a plastic mannequin, but if it was a human, it would stick. So then the ostomy bag can just be clipped on, and there you go, it's changed. I just want to show that this one is closed with Velcro instead of a clip. So if you were to empty this, you would take a basin, a graduate cylinder, a vessel of some sort, and just open this up and squeeze all the stool out. And then something else and then you would like clean the end of this and then wrap it back up. And something else I just want to demonstrate while we're here is that sometimes ostomy bags can fill with gas and need to be burped, but you don't want to burp it through here because then stool will come out as well. And bags don't need to be changed until they're 3/4 of the way full. So you would just lift up this tab here and just gently squeeze and get all the gas out, and then just close it back up. And you'll also want to date, time, and initial the if you're changing it in hospital, you're gonna want to, or at home either, but you want to date, time, and initial when this was changed, because it needs to be changed every 3 days normally, but sometimes 3 days. And also something else I want to mention is that you want to change ostomy bags when the bowel is at its least active. So when they haven't eaten for a few hours, or first thing in the morning when they haven't eaten at all, because otherwise you'll just have stool constantly leaking out while you're trying to change the bag. You can either plan it on the patient's last meal, or you can ask the patient if they've had the ostomy for a while when they typically change their bag, because they'll know.